If you or someone you know is facing esophageal cancer, doctors right here in Massachusetts are working on a more personalized way to fight it.
Yeah, with the help of clinical data, Mass General Brigham is seeing real results, and it could signal a new era in precision medicine. And I got an inside look to see how it works.
I still try and play now.
Michael Kelbline loved to play basketball, was in great shape, and started having trouble swallowing. He thought it was acid reflux. It turned out it was going to be a long road ahead.
When the doctor told me that, as I went into this total shock, I didn't know where to go.
He was diagnosed with stage 3 esophageal cancer despite never smoking and no family history.
The current standard of care will achieve cure in approximately half of patients at a 5-year time point. That number, frankly, keeps me up at night.
MGB's medical oncologist Matthew Strickland and his team used a cutting-edge approach for Mike's treatment based on a recent clinical trial.
They told me right up front I would have 4 rounds of chemo every 2 weeks, a round of chemo every 2 weeks. They also told me I'd come home with a chemo pack that had to go through my system for another 48 hours.
The tumor shrunk. It was working, and working so well, he was able to take a break and walk his daughter down the aisle at her wedding. Dr. Strickland says his team is working on exciting new therapies like immunotherapy and target therapy.
Increasingly, we're taking into account the molecular profile of the individual patient, and this allows us to tailor the therapeutic plan in a way that that individual is set up for the very best outcome.
After 4 rounds of chemo, 28 days of radiation and surgery, Mike is cancer-free and living life to the fullest.
And Dr. Strickland says gastrointestinal cancers in patients under the age of 50 have actually doubled in the last 2 decades. They're working to learn why. But in the meantime, he says their team is part of discussions to begin changing these guidelines to standard of care to have a precision medicine approach.